Individuals battling substance use disorder, a digital story about stigma and substance use disorder. Nardi et al. 2024 states anxiety symptoms and substance use disorder, including disorders associated with both alcohol and illicit drug use, are highly comorbid and represent two of the leading causes of disease burden globally. Epidemiologic studies have identified several factors associated with receipt of substance use disorder treatment, including male sex, older age, later SUD onset, lower levels of education, employment, income, being unmarried, and more severe substance use. Comorbid mental health diagnoses, recent use of mental health services, and lower self-stigma. This is stated by Bommersbash et al. 2021. Individuals with substance use disorder suffer with shame, fear, withdrawals, and are more likely to experience anxiety and depression. William et al. 2020 states substance use disorders are commonly comorbid with anxiety and depressive disorders and are associated with poor treatment outcomes. Furthermore, Vagalanka et al. 2025 states stigma, isolation, and cultural beliefs create social barriers within rural settings and may further diminish mental health and substance use disorder treatment, engagement, and utilization. Individuals of all races experience stigma and discrimination when trying to get help for substance abuse disorders. Mays et al. 2017 draws significant attention on racial and ethnic disparities in mental health status and mental health use services. Blacks and Latinos are less likely than whites to receive mental health or substance abuse services and are more likely than whites to delay seeking care. Even when Blacks and Latinos do receive mental health and substance abuse services, they are often more likely than whites to obtain inappropriate diagnoses. For individuals battling substance abuse disorder, they already have a sense of shame and guilt. According to Rossner et al. 2021, stigma, prejudice, and discrimination create a hostile and stressful social environment, adding to internal stressors such as low self-esteem, shame, guilt, and internalized stigma, which are already elevating the risk of substance use disorders and other mental health problems. Pickard et al. 2017 states most admissions to treatment for substance use disorders have some sort of life circumstance influencing them. It may be health-related, occupational, relationship, or some other. However, legal mandates are unique that they have clear and profound consequences that can be leveraged in a way to encourage people to stop their substance use. Who is this population made up of? Well, it could be anyone. Women, men, mothers, fathers, sisters, brothers, and individuals of different races and cultures. One study specifically examined substance use disorder in military veterans who are women. Evans et al. 2018 states many women veterans reported history of current and past alcohol abuse. For some women, unhealthy drinking behaviors developed prior to military service, usually during adolescence and young adulthood. Other women described binge drinking during active service as a part of the military culture. In another study by Gao et al. 2024, it is stated how there is a crisis in mental health and substance use access and engagement by Asian immigrants. They think this is likely driven, at least in part, by stereotypes. For those battling substance use disorder, it can be very hard for providers to understand why they just can't stop. However, stated by Kurogelian et al. 2015, it is stated, a biopsychosocial model of illness is often applied to understand substance use disorders, including consideration of the relationship of demographic, gender-related mental health, and socio-structural risk factors to substance use and substance use disorder treatment. Behind every diagnosis is a human being, someone with hopes, fears, and a story worth hearing. When we understand how individuals perceive stigma in healthcare, we can begin to change it. We can create environments where patients feel safe, respected, and supported. Thank you for taking the time to listen to my digital storyboard.